And I want to talk to you about the mandate.
The government is running the exchanges.
I want to talk to you about the mandate.
They're turning everybody
Carly,
up on
you
October
mentioned
1.
that you were a breast cancer survivor. Yes. And let's put emphasis on the last word, which is wonderful. Part of what the new law is trying to fix is people showing up at the emergency room without insurance and then passing on their costs to businesses, individuals who do take responsibility for their own care. Because now there is a requirement for people to take responsibility, which, you know, most people have insurance, most businesses provide insurance, so you're talking about a small amount of people, matched with a ban on pre-existing conditions, we're actually lowering costs. So do you agree with the mandate idea? That is a Republican idea, came out of the Heritage Foundation. One of our co-hosts, Newt Gingrich, was behind it. And the ban on pre-existing conditions. Do you agree with those two provisions?
I actually do agree with those two provisions. And I think Obamacare remains an abomination, and let me tell you why. So, first of all, I think no one should be denied health care because of pre-existing conditions. And I think there are many more efficient ways we could have dealt with this than Obamacare. But let me just also make this point to you. Let me make this point to you. We could have subsidized high-risk pools. That's a lot less expensive than what we're doing now, and a lot less disruptive.
But it actually doesn't work for those individuals.
Sure it does.
Skyrocket
but let me tell you a real example.
Government would be paying more for that.
Let me tell you a real example. I would argue those facts. Let me tell you a real example in California. In California, there are 25,000 people whose job it is to answer the phone and tell people whether they are eligible for government-provided insurance. Virtually, I happen to know this because of a foundation that I sit on, the Foundation for Health Coverage Education. It turns out that an amazingly high percentage of people who are eligible for government-provided programs like Medicaid and Medicare don't know it. Why? Because the government is ineffective at determining their eligibility.
Okay. So
example after example after
example. So get back to
government
the individual
doesn't
mandate
run
and the actual question that I asked.
I answered your question. I answered your question. I said an individual.
You just don't think that it could be implemented. Is that it?
No. What I am saying is that we have now a situation in Obamacare where we have insufficient competition in private industry for insurance, and we have the government playing a larger and larger and larger role in what they will pay for.
The responsibility provision. People have to take responsibility for their own care, and you are for the ban on pre-existing conditions.
Yes, I am.
Okay.
But do not put words in my mouth. I am not for anything that went around either one of those in Obamacare.